I had Hannah in New York, the Bronx, and they do newborn screening. So I think in a week they called me and told me that Hannah had sickle cell.
When I started to grow up and I realized not every child goes to the hospital every 3 months. Not every child is always getting IVs and taking the strong pain meds that I'm taking. That's when I realized how major it was.
Hematology is the discipline in medicine that deals with problems with your blood. Anyone with a blood disorder, rare or common, can come and seek care at Children's Hospital Colorado in the Department of Hematology. So we are a nationally recognized top-ranked program that sees high volumes of patients with very rare disorders. When you are looking at treatment for some of these rare conditions, it is really important to go someplace with a lot of experience and excellent documented outcomes. One of the main considerations for patients seeking care for blood disorders is feeling very comfortable with the provider that you have chosen. A lot of treatment for patients with blood disorders really relies on shared decision-making between the physician and the family, as there may not be one right-size solution for every patient.
We moved from New York. When we came here, we saw that the treatment here was different from what we were getting in New York. Everything they were doing was different. The treatment, how the staff is, everything was really exceptional here.
We have a very large group of experts in a wide range of fields within hematology. Some of us focus more on bleeding and clotting problems, and some of us focus more on disorders that affect red blood cells, white blood cells, or platelets. The team is trained across the country at very large centers and is very active in the setting of research. We also have a multidisciplinary team who are integral in providing comprehensive holistic care for our patients.
They made sure I understood what they were saying, and then whatever question, whatever problem I'm having, I have somebody there that can answer or help me with it. So that gave me the hope. Yes, they were really there for us.
Our hematology program offers a variety of treatments which range from symptom management to curative therapies. A lot of hematology is focused on diagnostic considerations, making the diagnosis, figuring out what the underlying problem is, and then treating that underlying problem. The landscape for patients with hematologic disorders is rapidly changing. In the last several years, we've had 3 new medications which have come to market for patients with sickle cell disease. Additionally, we have new gene therapy options for patients who have hemophilia as well as sickle cell disease and thalassemia. So no longer do we tell patients when they're born that this is necessarily going to be an issue that they're going to have for the rest of their life, because increasingly we have options that may be able to correct those disorders.
After multiple crises, I had one that was just the worst one yet. Pain meds were not doing anything. I was in major pain, and that's when I met Dr. McKinney. He came to me when I was admitted in the hospital, and then he told me about the clinical trial. He told me of a possible chance of getting well.
Over the last several years, new advances have been made in clinical transplant that have allowed us to expand donor options for these patients. So we can use donors who are only half matched to the patient, which we call a haploidentical transplant. Or now we're using autologous gene therapy, where we take the patient's own stem cells, alter them, and then reinfuse them in the hopes of correcting their underlying genetic disorder.
And my sister, my older sister, was an 83% match, and that's when we were like, this is perfect. We would be able to use her bone marrow and then help me get better.
Clinical trials make all of this possible. We cannot offer new treatments until those treatments have been shown to be effective in patients. So participation in clinical trials provides these patients access to therapies which are new and potentially will change the paradigm for how we treat these patients.
Dr. McKinney sat us all down in the room and then got out a board and a marker, and we went through everything. These are large medical terms, but the way he said it, the way he would describe it, the way he would use examples, it was just a big relief. It was just easy for me to make a decision. I felt like I feel safe with this person. I can trust this person to give me the treatment I need.
We are a nationally recognized, top-ranked hematology program who sees a high volume of very rare disorders. It is very important when we're dealing with rare disorders to be at a place where you have people who are familiar with the disorder, familiar with the potential complications and long-term issues that might arise, as well as has access and availability of the latest treatment options. This is something that is only able to be performed at a handful of national hematology programs. Our hematology department here has several unique programs which are not found anywhere else within our 7-state region. We have the only comprehensive hemoglobinopathy program to provide care for patients with sickle cell disease or thalassemia who are identified on newborn screening programs. We see patients who come here for the expertise that we have in some of these very rare disorders that most places do not see very frequently. So at the Children's Hospital Colorado, we have a very close relationship with the Hemophilia and Thrombosis Center. This allows us to provide lifespan care from our patients from birth through adulthood. So there's no need for them to transition care when they turn 18. They will continue to receive care from the same physicians and the same providers in the same building for the duration of their disease.
Ooh, there were a lot of appointments to make sure, to check all the organs in my body, from my head to my feet. We checked everything to make sure everything was good before I went into treatment. While I was there, I met some amazing nurses who made my stay just great. I'm gonna cry. She was, sorry. It was really great to have someone I had built such a connection with help me on my road to recovery.
My hope for my patients is that we will be able to tell them that one day they do not have to worry about their blood disorder anymore. I hope that we're able to continue to provide the latest, most up-to-date therapies for these patients, that we can turn life-threatening disorders into either chronic illness or cure those disorders. I hope to see continued growth and expertise in our mission to continue to train other physician providers who will then provide those same services for the next generation.
They called my phone, and then they were like, oh, you're 100% donor, so you're cured. I think I kind of stopped in my tracks.
This has been really a relief for all of us. And her, 100% that she can do whatever she wants with her life.
It's hard to believe because I had that for 17 plus years, and to finally tell me that, I'm 100% donor now, I don't have sickle cell, it was a pretty big moment, mind blowing actually.